I'm Dr. Dickerson. I'm the acupuncturist here at Great Lakes Health and Wellness, and today I'm going to demonstrate a protocol for pain management on a patient I've been seeing for the last 2 months. But prior to doing this, I would like for you to listen to her experience, how she started out and how she's progressed so far. And after that, we'll go ahead and do the protocol, and I'll explain each point as I do it.
I started out seeing Dr. Dickerson for pain in my shoulder, and when I started, my pain level was about a 10, and we have it down to a constant 2. I also had no range of motion in my left arm, and now I can lift it all the way up over my head. Previously, I was unable to lift my arm to even take my shirt off.
Okay, so what we're going to do now is I'm going to ask the patient to move every area of her body that hurts on each needle that I put in, and then she's going to give me the level of pain as it goes down. If it goes down significantly, I will finish up that protocol in the ear that it goes down. Otherwise, we just keep going back and forth until we get to the level of pain reduction that we're looking for. And I'll explain each point as I do it. Okay, the first point we're going to use is called cingulate gyrus, and it's part of the limbic system in the brain that deals with the emotion felt from pain. And then I'm going to ask her to move her shoulder, her arm for approximately 30 seconds and ask if there's any change or no change. If there's no change, we'll go to the opposite ear and do the same point. Okay, go ahead and move that arm. What was your pain level right before we started?
About an 8.
Okay. Any change?
A little bit, but not much.
Okay, so then we're going to go to the next one and do the same point, the cingulate gyrus. Again.
That significantly reduced it.
To what number?
Probably like a 4.
Okay, from an 8 to a 4 is significant, so I will finish the protocol up in that ear. She will have 5 needles in this ear. The second point I use is the thalamus point, and the thalamus is responsible for your perception of pain. Go ahead and move it. Her pain level can still go down with each needle I put in.
It's about the same.
Okay. The next point I'm going to use is called omega 2. It's specifically a point that was designed for musculoskeletal pain. It's the one I stimulate the most because of being skeletal muscle. Go ahead.
That significantly dropped it?
Down.
Yes.
And how far are we now?
Almost 0.
Okay. The next point is called point 0. Point 0 is considered the point for homeostasis. It's as if you were still, if you were to look at a picture of an inverted fetus, this would be the umbilicus. So it basically puts your body back into homeostasis as if you were still in the womb.
Feels a lot better.
Okay, and I'm going to put in the last point of the protocol. It's called Shinman. This point is basically for anxiety, relaxation, increase in blood flow. I use this point first in all my other protocols, but it's the last one in this protocol.
Pain-free.
Huh?
Pain-free.
Pain-free? Okay. So what I'm going to do is I'm going to add in an additional point on the right side, since you've got some needles on the left side, and it is going to be the point of the actual joint that's bothering her, which is her shoulder. So I will put the master shoulder point. and then a muscle relaxation point. Then the patient will lay back for about 20 minutes, and I will turn the lights down, put the music up, and then we'll come back in and take the needles out, and then we'll ask her again how her level of pain is. Is that okay? Okay, is that too loud?
No, it's
Okay.
fine, thank you.
So I'll be back in about 20 minutes.
Okay,
Are you cold? Need a blanket?
no, I'm good, thank you.
Okay. Okay.
Come in.
Okay, I'm gonna turn the lights up. It's not a shock to you. These up, and I will take each needle out. And no bleeding. Check the side one more time.
I feel great, thank
How do you
you.
feel?
Amazing, thank you.
Okay, you're welcome. All right, you have a good day.
You too.
All right.